Good afternoon. Welcome to Join the Conversation's first Facebook Live presentation, Breaking the Barrier, Learn to be Comfortable Ask for Help. I'm Karl Shallowhorn, Chair of the Erie County Anti-Stigma Coalition and President of Shallowhorn Consulting. I will be moderating today's discussion. I'm joined by Jackie Crane, Program Supervisor for the Mobile Transitional Support Team at Crisis Services, Lindsay Herndon, Director of Outpatient Services for Mental Health and Substance Use at BryLin Behavioral Health System, and Jennifer Levesque, Director of Clinical Services at Jewish Family Service. We know the stigma surrounding mental illness is a barrier to people seeking help. Over the next hour, we want to help you or the people you care about overcome their apprehension to reaching out for services if they find themselves struggling in any way. Some housekeeping notes before moving on. We're going to hold questions until the end. However, throughout the presentation, feel free to enter your questions using the chat feature, as we will get to as many as we can before concluding. The COVID-19 pandemic has become a mental health crisis across the globe, taxing an already stressed mental health care system. Due to social distancing, isolation, financial securities, and an uncertain future, people who have up to now never needed services are finding themselves experiencing symptoms of stress and anxiety and struggling to cope. Traditional services are more difficult to access due to stay-at-home orders and growing need. Newer services like Teletherapy are now more readily available to provide support remotely. Today's panel will address how their organizations are adapting services to meet the needs of our community and hopefully educate and ease the fears of those who seek assistance. So I'm just going to start off with a general question for all of you, and maybe just start with Lindsay. So Lindsay, can you just tell me how you found the calls you received from people seeking help? Has it increased since the pandemic has surfaced?
Sure. So we've actually gotten a lot more calls since this all started. It's definitely on our mental health side, we've gotten calls, just a wide variety. A lot of depression, anxiety issues are really popping up a lot more now. And people are really seeking the help that they are recognizing they need right now, which is great. The influx of calls can definitely mean that there's even more than what's coming in because we only get a certain percentage. So I think that at least people are starting to admit that they're needing some help with everything that's going on.
And what about you, Jennifer?
I would definitely have to agree. We've seen an increase in phone calls, people looking for assistance, people, as you mentioned, who may never have needed services before and are reaching out for the first time. So that's been really, really great. And also a recommitment from clients that we had been seeing, really reaching out as far as keeping appointments, really recognizing, wanting to increase service frequency of services. So we're definitely seeing, those same trends. And I think that, we're only going to see it increase.
Now, of course, Jackie, you are at Crisis Services, and certainly your organization for years has always been on the front lines of receiving calls from people that might be in distress. Have you seen an increase, and how has that affected your organization?
So we actually started tracking the numbers once the COVID pandemic really hit Erie County. So starting on March 3rd, we started tracking all of the calls into our hotline, and to date, it's a little over 18,000. So surprisingly, this is actually lower than our numbers that were trending from last year. So we haven't seen a significant increase, but we're definitely still staying busy. We've also been kind of separating out the COVID calls just to keep kind of a handle on what people are calling about in regards to COVID. And we have seen about 1,600 calls into our hotline, specifically COVID related, since March 3rd up until last week when I was able to pull the data.
So piggyback on that, what would you say are people asking about? What are they reaching out for? What are their concerns?
So people who are calling specifically related to COVID is really around anxieties, kind of covering a broad spectrum of things. People are concerned about the death tolls, how the community has been impacted. People are calling because they are having food insecurity for the first time, and they're looking for resources in the community. And then we're also getting calls from maybe elderly or others who don't have significant social supports or family members right now. So the feelings of isolation and loneliness have really increased. And they're reaching out just to get a little bit extra support from our hotline workers.
And what about you, Jennifer? What are you seeing from people that are calling? What are some of their concerns?
We're definitely seeing people who are having concerns for the first time as far as, financial, basic need, anxiety related, a lot of people who have been laid off or furloughed. We know that there was a major rush toward unemployment, which got delayed, which was causing anxiety for those basic needs. Again, people who may never have needed that support before were, for the first time ever really facing those real concerns. And two, to piggyback on the older adult population, we have a lot of specialized services for that older adult population. And especially with telehealth, those are clients that we had that had difficulty making the switch. We were, our clinicians seeing them in the home was really the only social interaction that they had. So making that switch, sure they were able to participate in that way.
So Lindsay, what you heard so far from Jackie and Jennifer, are these themes consistent with what you're hearing? Any different things that you're hearing, or any other instances?
So yeah, most of it is very similar to what we're seeing here. We're seeing a huge uptick in the depression, anxiety. Past clients that had successfully left treatment, they're coming back to get kind of some more support from us. We've recently opened our child and adolescent clinic, and that has really shown that this is impacting people of all ages. We have quite a few adolescents and kids that have more anxiety coming out because of everything that's going on, and such an unsure world for them right now, especially with schools changing and their parents might be more stressed out. So we've definitely been seeing the anxiety and depression uptick, but this also causes more individuals to just not be sure in general with where they're going to get their next meal or how they're going to survive in the long term. And that anxiety is what's fueling, I think, some of the calls that are finally coming in that they need the help.
That's when you say that, because I've heard each of you say that this idea of that almost like we talk about the food insecurity, some of the basic needs even that people are experiencing are impacting their mental health. So how would you relate those things to people's concerns? And for instance, how would you say that, I'll just give an example. If someone is having difficulty, say, with accessing the food they need for their family, how would that impact a person's mental health? And then what would that be some of the things that you suggest for them to do? So maybe, Lindsay, how about you? What say about that?
Sure. So, how wouldn't that impact somebody's mental health? Really, it comes down to it. If you can't get your basic needs met, and if you can't provide for your children or your family, and not knowing where your next meal might come from, I think all those feelings of hopelessness will just get worse, and anxiety and the worry just builds up exponentially in this time. And that's really impacted mental health because people will just keep falling down that hole, so to speak, and get kind of stuck there if they don't have some support to help them know where to start to get the help. I think any mental health provider can offer resources, help get linked with case management, be able to give some ideas of where they can get these needs met, because you can't do any mental health treatment until basic needs are actually met.
Right. And so essentially, I think what we're talking about here is the fact that when people are having difficulty with those basic needs, yeah, absolutely, their mental health is going to be affected. And hopefully there's ways, and I know each of your agencies have their own ways of addressing those needs. So I guess as a follow-up, the mental care system we know has had to quickly pivot. I know people have been using that term a lot, pivot, as a result of COVID-19. But so how has the mental health system changed or pivoted to adapt to the needs of its people they serve and their clients or patients? What would you say, Jennifer, about that, of how your agencies had to adapt?
So first and foremost, the challenge was getting our telehealth up and running. We had the support of our local OMH field office and all the guidance that was coming out. We were fortunate enough that There was kind of like a week or two, we had a fair warning to kind of get things up and running where they needed to be. So first and foremost, that for us as an agency, right now we've successfully been able to do that. All of our services, right now are being offered via telehealth. We do have the capacity, to see clients that are unable to engage, but fortunately we've been able to connect with clients and, kind of trickling down from there, getting clients who had been used to having that in-person, face-to-face interaction, that really is a huge part of the therapeutic relationship and the therapeutic alliance, and kind of reshifting those skills and that rapport to that awkward, now I'm in my home, now I'm on camera, those types of things. So really shifting that and kind of, pivoting, to echo your word, as far as just making the transition as seamless as possible.
Right. Now, Jackie, with Crisis Services, your service is basically, telephone based. So are you incorporating, of course, this is just based on my own ignorance, are you incorporating any kind of telehealth or telecommunication in terms of video conferencing, or is it still phone based? But also, how have you adapted regardless of what the mode of, I guess you could say, connection is?
Yeah, so actually we do have a few different departments at Crisis Services. So our first source of contact for people typically is our hotline. People are most familiar with that, but we also do have our mobile outreach department, our mobile transitional support department that I supervise, and then our CIT department, who is our case management. And then we also have an advocacy department for survivors of sexual assault, domestic violence, elder abuse, and family violence. So we have all shifted each department, and we did it very rapidly, as we all needed to do. But it went relatively seamlessly. So our hotline staff is still currently in the office, but most other staff have moved remotely or completely mobilely. So our hotline staff are spread throughout the building, but they're still in-house. So besides the social distancing that took place, not much changed with their day-to-day. For our mobile outreach team, they are still conducting face-to-face visits, utilizing personal protective equipment, maintaining social distancing, and also offering protective equipment to the clients that we're going out to assess. But in all of our other departments, we are utilizing the telemental health platforms or the telephonic screenings as well. And so we luckily had most of the technology that we needed to do that, and it was a pretty quick shift for us. However, it definitely took some getting used to in terms of there's no longer that face-to-face. We have to get comfortable utilizing a screen more, and that's been a really significant change.
And so, Lindsay, how about you? Have you heard of how Crisis Services and GFS have made the change? How about you folks, your agency?
So we've done the same. We were able to pull together our telehealth program within a week and got everybody moved to most of my counselors are working from home at this point. So we got all of that set up so they can do their sessions telehealth via webcam from home. We're able to continue our medication-assisted treatment program for Suboxone and Vivitrol as well. And we also do in-home inductions for that at this point. So we were able to get everything moved over to telehealth. We'll have the counselors coming back to the building in mid-June, but clients are going to stick with telehealth for the foreseeable future until we have to move back to face-to-face. And in that case, we've put into place all the proper procedures. But it's been really good to how swift and quick the staff here was amazing with moving something completely new for them and just jumping on and head first and getting it handled. And the clients seem to be responding to it really well. It was a little bit of a transition at first, but I think once everybody got the hang of it and felt like it could work and it makes sense, that they were happy with the results overall.
That's great. So why don't you tell a little bit more about what a person might expect, say they are first time, going through the process of teletherapy, telehealth. What's that like for them?
Yeah, so I think, of course, it's a little nerve-wracking because there's always those technology piece of it, and you never know if it's going to go perfect that first time. But we always try to ease those concerns right off the bat when they make the call here. We'll get them in as soon as possible with the counselor, and they'll start their assessment process. In the first appointment, we do always ask for webcam. We can do telephone sessions after that one, but I do ask for people to have the webcam just so they can see somebody and get that face-to-face experience in a sense, so they can feel more comfortable with their counselor that they're talking with. If they can't do that, it's not like we're going to say no. Of course, we can just do a telephone initial assessment as well. And the first appointment's an hour long. You talk to your counselor, you kind of tell them what's going on for you. They get some extra information, get to know you a little bit. And then we try to schedule all of our appointments at one time. So they'll schedule the first 2 or 3 appointments on your first phone call into the clinic here. So you'll get a counselor that is definitely available to finish your assessment within those first 2 to 3 weeks to make sure you're getting the care you need right away. That just makes sure that there's no full schedules that you can't get in for 2 to 3 weeks when you really need the help. So scheduling them ahead of time really has been helpful, and making sure that clients are interactive, and if there's anything the counselors can do to build that engagement. They've been trying new things, and webcams have definitely helped quite a bit to get that set up.
Great. So Jennifer at JFS, how about you? How's your agency? What can people expect there?
Sure. So anyone looking for services, we encourage them to contact our main intake line. They'll speak to our friendly intake staff, kind of walk through the process of getting that first appointment scheduled. We are asking for email addresses to send paperwork. We're hopeful that people can take screenshots or pictures to return it, but if not, just to have in front of them. So when they are interacting with the clinician for the first time, they're looking at the same thing. They're kind of feeling that same interaction. And then after that, the clinician will reach out to them, send them a Zoom. We're utilizing the Zoom platform invite as far as utilizing video conferencing. And then they can expect that the counselor is going to log in 5 minutes ahead of time and be right there, that friendly face to meet with them. Our sessions are also about an hour long, kind of getting that feel for what's going on, meeting the client, explaining a little bit about how the process is going to go. And then again, scheduling those subsequent appointments so they can be sure that we're available for them as they need. The clinicians have been really great as far as kind of merging their online schedule to their Zoom schedule, getting all of that. So the client doesn't have to worry about any of those things. They can just come in and feel supported.
So now, Jackie, of course, of Crisis Services, what you provide isn't necessarily the same type as say, JFS or BryLin, but in terms of what you do, like you talked about your mobile, outpatient transition team. What do you do, or what can people expect with that? Because obviously, if someone makes a call and you need to provide that type of outreach, what would that look like for a person?
So within the mobile transitional support team, we link with our clients as they're being discharged from an inpatient hospitalization. So most of our referrals come from ECMC, and what we do is we provide an introduction to service. We're actually reaching out to the client on the patient phones and introducing services, and if they are agreeable to signing on, we're collecting their email address and their phone number and offering. We also are using Zoom. Zoom is a platform, but not everybody's comfortable with that, and maybe not everybody has the technology, so just utilizing the telephone is fine as well. And we do meet once a week for 1 hour sessions, and we are a short-term program. So we link with our clients for about a 3-month period. And then something unique about our program is that we have our licensed counselors working hand in hand with peer specialists who have experienced some of the same things that our clients have gone through. So it's actually 2 MTS employees on a call with one of our clients to just provide, 2 different perspectives.
Now, that's true you say that, because, when you think about it, there are people that might have an experience, say, with more profound, I'll just put it that way, mental health concern, They might feel, and this is for anybody here, they might feel like, because we're talking about overcoming barriers, right? So you might have a person that might be experiencing a concern that, say, might put them in a position of not feeling safe using the technology. How do you address that? This is for anybody.
I mean, we've definitely encountered that, calling people at the hospital who may have some fears around surveillance and technology use, and they're just not comfortable utilizing a video platform. And that's perfectly okay. We'll, still explain that it is very secure. Security measures have increased since the beginning of Zoom. I know a lot of things initially came out regarding security questions, and a lot of those issues have been resolved. But if somebody's not comfortable, that's not going to prevent us from working with them whatsoever. We can still utilize the phone.
Yeah, and I think that's the whole point, right? We want to make sure that treatment and services are available for anybody, and that I think what we're hearing here, I'm hearing you say, is like flexibility is a lot of what it's all about in terms of helping a person. How about you, Jennifer, with your agency? Are you doing anything differently for folks that might not be comfortable with, say, a video platform?
Oh, we're definitely offering exclusive telephone services as well. So we do have some clients who have indicated that they would just feel more comfortable. I think too, a little bit of it is also secure. I think sometimes people don't trust that their internet connection is going to hold for that long too with video. So I think some people at times just feel more comfortable being on the phone, not having the call drop. One thing that we're seeing too is really working with clients to identify those private spaces. We're seeing people who are at home with loved ones who may or may not be brought up as subjects of their counseling appointment. So, really getting creative as far as making sure that that isn't a barrier to engagement as well, and working on working with clients as far as that privacy goes too.
And what about you, Lindsay? Are you offering any flexibility? It sounds like other agencies are as well. So you're doing the same kind of thing, I would imagine, with telephone and so forth.
Yeah, we are, and it's nice. We do, of course, reassure our clients that we use Doxy, so it's a HIPAA compliant platform for our webcam. So we tell them that we prefer to use that unless they can't for whatever reason, and we're totally happy to do telephone calls. And if they're not comfortable with getting the documents off of our website, or if they prefer to get them other places because they're worried about that piece of it, then we just do verbal consents. So we're definitely flexible. We just want to make sure that they're getting the help they need.
So we're really in a new world now. So for those who are watching right now, they may not be aware that telehealth was around even before we had COVID-19. Obviously not to the degree that it is now being offered, but I show you to kind of put on your take out your crystal ball. All right, we're going to look ahead maybe in the next 6 months, a year, once things, some of the restrictions are lifted with the social distancing, being able to get back out in the community, once services are able to be provided more on site for each of you. Well, maybe not crisis services so much, but maybe for GFS and BryLin. How do you see the services being offered, including telehealth, in the future? Will it continue? Do you think you'll still be having those kind of those opportunities for folks to connect?
So I know BryLin plans to. We're already in the process of getting our permanent ability to use telehealth because we just don't know what's going to happen. They're wondering if COVID might come back in the fall. So we're trying to be as prepared as we can. I'm writing a pandemic plan as we speak to make sure that, we don't have to rush to get together, that we're already just be able to utilize telehealth when it's necessary. And, just the biggest could be is making sure insurance will accept it. And I think after all of this, that they'll be more willing to do that. So we're going to use it to our advantage. And hopefully that will offer most people the ability to link with services even easier than before.
Right.
So,
GFS had also been working on getting our telehealth up and running. I think, the COVID pandemic really kind of pushed that to the forefront as far as, priorities for new programming within the clinic. I definitely don't think that it's going away anytime soon. I actually think of this more as the new revert back to a home visit. So we know doctors used to do home visits in person years and years ago, and it kind of got brought away. And I think that this is more of a virtual swing back with the times to really delivering those in-home services. And I think it's going to go a long way to overcoming some of those barriers, as far as the, not being in a crowded waiting room, being able to do this at the privacy of your own home a lot quicker, as far as logging into a session versus driving, those types of things. I think it's really going to eliminate a lot of those barriers that we've come, that we've recognized as a community. And I would agree. I think that not only insurance carriers, but also, again, OMH really lobbying to the state as far as keeping telehealth and really growing that program and what is allowable as far as the provision of services. So,
of course, Jackie, I don't want to leave you out of the conversation here because you already talked about how your mobile transition team, mobile outpatient transition team utilizes telehealth. Do you see yourself, your agency still continuing with those services once these restrictions are lifted?
Yeah, so we definitely have been talking a lot about that. And actually, right before the pandemic had hit this area, we were beginning a pilot project with Evans Police to do a tablet program to utilize telemental health, specifically with our mobile outreach department. So this was already kind of in the works, and then the pandemic really forced us to move forward with it throughout the agency. But just knowing, like, we live in Buffalo, there's blizzards, there's things that really prohibit our teams from driving out to clients' homes. And this can be a really great way to reduce that barrier. I would love to see that face-to-face resumed again eventually when it's safe to do so. But even when that happens and maybe a client prefers this method, I think all of those things are being explored and talked about. And I think this has been a great opportunity to show how successful telemental health really can be for people.
Excellent. Now, another feature, so once again, the theme is overcoming barriers. That's what we're talking about today. Another barrier for folks that might be there, or there might be a misconception, but it's over fees for service. So there's a lot of ways to, of course, pay for services that one receives through mental health treatment. How are agencies dealing with that in terms of fees, insurance, whether it be before COVID or even right now during COVID? I guess there's some provisions being made by the New York State government to help with providing assistance. So can you tell me about that, Lindsay? How you're doing that in your agency?
Sure. So, of course, our mental health clinic is community-based, and so we accept all major insurance. I think one of the misconceptions from BryLin is that even inpatient, they don't accept certain insurance, but that's not the case anymore. They accept any and all that come through. And same thing with outpatient. We're working on making sure we can accept as many insurances as possible. For telehealth, for private insurances, it just depends on when they decide to stop paying for telehealth, but we're going to push it as much as we can, make sure we can still offer it regardless. And I think most people can have some form of health insurance. We do Medicaid, managed care. We can accept any of those. And if somebody just doesn't have health insurance, we'll do a sliding fee scale. We can always find a way to try and make something work so you can get in for sessions. If it's a cost issue and a sliding fee scale is still too high, trying to say, okay, we'll space out some sessions to try and get you the best help we can, or possibly look at other referral places that might be even cheaper than we are. We always want to make sure we're offering whatever we can to get them the help.
So Jennifer, what about JFS? How do you guys handle it there?
JFS also accepts most major health insurances, Medicaid, Medicare. So, prior to the, and still now, we're working with any potential client as far as finding out what their insurance is, working with co-pays, those types of things. As COVID has happened, most insurances, I won't say all, are waiving as per, the state and federal guidance, the cost sharing. So as far as waiving co-pays for clients, it initially started with Zoom, and then there was the recognition to waive copays also for telephone only. We've been fortunate to have been awarded grant funding to also help mitigate some of those copay and or uninsured clients as far as addressing those barriers through the funds that we've received specifically due to the COVID pandemic. So, again, we're encouraging any client who is interested to call our intake staff and really walk through the process to make sure that we're working with them to eliminate, any and all barrier to them getting assistance.
That's great. Now, Jackie, with crisis services, certainly, it obviously doesn't cost anything to call when a person's in crisis, but the other services you provide, is there any fee associated with that at all for folks?
So our advocacy services are completely free, as well as our CIT case management and our MTS program. They're all free of charge and all voluntary services. Our mobile outreach team does have a bill if a full assessment is completed, and that's because we're contracted through ECMC as their mobile team. So it's similar to an emergency room bill. You don't have to have insurance for us to come out and complete an assessment. We do, try and work with people, and that's never an issue. If somebody's in a crisis, we're going to come out no matter what.
I just want to remind our viewers that if you have a question or a comment, you can feel free to type it into the comment box if you're watching on Facebook Live or the chat box. We're happy to try to answer, or let's say the panelists are welcome to take your questions and try to answer them. So right now, it seems like, though, that overall, when you look at the landscape of where we're at right now, at least in this region, I can't speak for other parts of the country or even the state for that matter, but Western New York seems to be doing okay. Is that a correct assessment with how we are right now in terms of being able to provide these services? Lindsay, what do you think? How are we doing? What's your take on that?
I think we're trying our hardest. I think it's a lot of individuals that need help right now, and it's just going to keep growing. Is the biggest concern in making sure that everybody that needs help is getting what they need. So I think Western New York is ahead of a lot of areas in the fact that we're recognizing this is something that's never really going to go away, and trying to make sure that help is out there. So yes, I would say Western New York is ahead of most from what I know. New York, in that regard, we're acknowledging mental health is important, and with seeing that the calls are starting to come in, it looks like people are overcoming barriers and understanding that it just doesn't usually get better on its own. Usually you need a little bit more support than that.
Yeah. We did have a question that came in, and this is for each of you, as far as veterans. What support are you providing specifically for veterans? Do you have any veteran-specific programs or any outreach or partnerships with veteran agencies?
We don't have any exclusive partnerships with the VA or veteran programs, but we do have veteran clients that we serve in our outpatient services, whether it be our traditional clinic services through telehealth or services specific to the older adult population. We do have services specific to essential healthcare workers in that, right now. So any essential worker as far as those services, but not exclusively for vets.
Okay. What about you, Lindsay? Are you doing anything exclusively for vets or any type of special programming?
So we do get veteran clients that come in here. Do we have a specific group or anything set up for that? Not at this time. I will say that pretty much all of our mental health counselors at BryLin Outpatient are EMDR certified for trauma, meaning that they use a specific therapy that's very effective for trauma focused treatment. And I think a lot of the issues that are happening right now with COVID are going to make the past trauma even worse. It just exacerbates all of the different symptoms that come up with it. So in offering that specific treatment, we're able to accommodate veterans a little bit more than I have seen in other places be able to do, because we offer that in a short-term way. We're also now starting to do a new therapy for adults in our clinic for both essential workers. I think it would work great for veterans as well. It's acceptance and commitment therapy, but it's combined with a few different other techniques to be about a 6-week program that's mainly for like essential workers, those impacted by COVID in any way. They can come in for 6-week sessions and kind of get a basic understanding and way of coping in a better way. So I think that would be really helpful for that veteran population too.
We just had another excellent question come in. This is for all three of you. How are you addressing, so let's just go to Jackie, because we haven't heard from Jackie a little bit. Jackie, so how is Crisis Services handling, how do you typically handle individuals that might be deaf or hard of hearing that are trying to contact you?
So we do reach out to Deaf Access Services and request an interpreter when possible. Sometimes it is a little bit tough in the nature of a crisis visit. If we can plan it ahead, we definitely request that interpreter to be on site. And then I know that they also, if it's an over-the-phone assessment, have the equipment set up to translate through the phone as well. In terms of our MTS program, we actually have not had any deaf or hard of hearing clients to date. However, we would still utilize the same interpreting services.
Yeah, I do actually know the folks at Deaf Access Services. They do a great job. What about you, Jennifer? Do you do anything, especially for those who might be deaf or hard of hearing?
Again, not specifically geared toward those who are deaf or hard of hearing, but we also use those interpretation services. It's a little different now that, the interpreter wouldn't be here on site. So it would be more coordinating whether, we have the ability to use that video function or, through the telephone translation. But we do offer those services as well. So
that's actually, you just say that because obviously, even though it's a telehealth kind of, visual, I actually had a conversation with someone, actually Pam Keffy, who is with Deaf Access Services, about some of the challenges of, telehealth and those who are deaf and hard of hearing, being able to, the coordination, like you said, of the services and being able to provide the proper interpretation. Is that a challenge? So, Lindsay, how about you and BryLin, as far as the service you provide for deaf and hard of hearing? Do you see any challenges with that?
Definitely. I mean, interpretive services are difficult regardless of if it's deaf or hard of hearing or another language, but we would utilize the same method as get our interpreter involved, try to get that video ability to do that, to make it helpful. It always creates a bit of a barrier because things are always lost in translation. So building rapport is a little more difficult, and making sure that you get the information you need and you're seeing and understanding it correctly is a lot more difficult in that regard. But I still would encourage those individuals to reach out, because even getting some help and even if it takes a little bit longer time to get the assessment completed or get into the treatment aspect, it's still worth it in the long run, and we'll still make sure that you can get that help.
Okay, another question just came through about, imagine I'm someone who wants to help those I work with, say a specific group or population of folks, or even someone I know. What are the steps I would take to get them to one of your agencies or to get them help? What could I do, and how would I be able to assist? Let's go with Jennifer on that one.
Sure. So anyone, again, who is interested in learning more about the wide variety of services that we have to offer here at JFS is encouraged to call our main intake number. That actually links not only with our clinical services, but our agency as a whole. So we make a point to have a warm greeter, someone is answering the phone to kind of triage. And then we'll get you right back to our intake staff as far as walking through the process of, what services we are offering, whether it be the intensive outpatient, treatment, whether it be the services targeted specifically for essential workers, whether it be, looking at those older adult services that are available, and then really connecting the client with the service that is going to be the best fit for them. And that may segue into, working into a different program. So they may start out with one program and into another. So we really encourage anyone to just make the call and we will do the rest of the work. We want it to be as easy as possible for anyone who is reaching out.
How about sharing the number at JFS where people can call?
Oh, sure. 883-1914.
And in addition to that, I'm going to get to you, Lindsay, in a second. But in addition to that, people can go to letstalkstigma.org, where you can find out information on resources that are available in the community. There's a wide number of agencies and other places where you can go to get help. So that's also another good first step for folks if they're looking for somewhere to go that's easily accessible online to letstalkstigma.org. So Lindsay, how about you and your organization? What steps would you provide, if any, different, or what's your number where people can contact you?
Sure, and the steps are going to be pretty similar. And I would just say that if you're thinking about making the call, make the call. Usually if it's crossed your mind a couple of times, it's time to make the call. And it's one of those things, it's a conversation. And you get to talk to one of our lovely support staff over here who will, okay, there's a few automated things first, but then you get to talk to a lovely support staff who'll get you linked up with a counselor and talk to you what our procedure is. And we do have multiple different programs. We have the substance use program. So maybe coronavirus has caused you to drink a little more, and it's time to get back on track with things. We have that services, we have adult mental health, child and adolescent mental health. We have a lot of different options to make sure that you're getting what you need, and your family is too. If you have a loved one who you're concerned about, we're starting to offer a free family group session through our substance use clinic that you can call and just talk about kind of what your worries are about your loved one, about yourself, and you just jump into the conference call and say what's going on. And to get the information for that, they can call our clinic at our substance use side for that one. The number for our substance use is 633-1927. And for our mental health side, for adults and children and adolescents, it's 634-5250. So we just want to make sure that everybody's getting what they need to do. And if you're thinking about making the call, just go ahead and make the call.
Excellent. Another question just came in. Is there any resource available to us for our workers to receive training and how to identify when someone is in a crisis and how to refer them to you? Well, I can actually speak to that real quickly. Mental health first aid is a great program that can help people understand what the signs and symptoms are of mental illness. That program is offered through the Community Health Center of Buffalo and Compeer, as well as other agencies in the area. So mental health first aid is a great resource for that. But also, what would you recommend for ways to learn how people can understand maybe what to look for as far as signs and symptoms when they might need to help someone? Maybe let's go to Jackie with that one.
I think that if you are concerned or you just have questions and you're looking for someone to consult with, calling into our hotline at 834-3131, it's a great resource to use. You certainly don't have to call in for just yourself. If you need some support for a family member, or maybe you notice your neighbor may be struggling at this time, you can call just to consult, to kind of ask questions, to get referrals to different agencies, to see what's out in the community. And then if the situation is escalating to a crisis, maybe the person is beginning to have suicidal thoughts, we can still reach to our mobile outreach team, who I did mention is offering both the telemental health services, but also still that face-to-face assessment if the person doesn't have the capacity for telemental health at this point.
So, Lindsay, say I'm concerned about someone in my own household that, can I make that call myself? How does that work?
So first and foremost, if you're concerned with somebody in your household, I think it'd be even more important for you to have that hard conversation with your family member or friend even, and say, I just noticed you're kind of seeming down, I'm concerned about you, and just expressing concern. We can't, if it's a child and adolescent, we can work with the parent to get them into treatment. Without all the child and adolescent consent there, we do try to get the informed consent of the adolescent, of course. But for adults, I think having that conversation to encourage them to come to treatment is going to be the hard part. We can't sign them up for treatment without their consent as an adult. So, but we can help you with some of that conversation, say, help you with some talking points. We're happy to guide you a little bit with that. And there's definitely some training resources online for that piece as well, to say, like, how do I have this conversation with somebody if I'm worried about their substance use, especially that one, because that's one of the hardest ones to even talk about and bring up, because there's a lot of shame that comes along with it. So being able to sit down with your loved one and say, this is my concern, and then having a brochure or having an idea or a number right then and there with it, and say, we can call and get you an appointment, and that's done. I'll be here with you, supporting you the whole time. I think that's what's really going to make a difference.
That's excellent. Great. That's a good response. We had another question that came through about how a church, or for that matter, any other organization, can get involved with the Let's Talk Stigma campaign and join the conversation. The way to do that is to go to the Let's Talk Stigma website. So that's letstalkstigma.org/membership. And on that page, there's a brief form that a person can fill out online that will connect you with our organization, our collaborative, and you'll get a response on how to follow through and become a member of the coalition. So any organization can become an organizational member. If you go to our website, you can see I guess we have at least 60 organizations now that are members. So it's a great way to get involved and just take it to the next level. So just want to let folks know about that too. So following on that idea of seeking help for someone that you know and you care about. So Jennifer, once again, say I'm in the position where I'm really concerned about someone and I don't know what to do, and I'm worried about, maybe I'm seeing things. What should I be looking for? What were things to look for in a person maybe that you think might be having trouble, but you're not too certain of it?
I think the biggest thing would be, a change where it looks like they're not able to do things that maybe they were able to do previously. So I think the difference is, everyone's feeling stressed, especially now. I think the difference is, when a friend or a loved one is expressing, I'm so stressed, I can't do this, or I'm so stressed, I can't think of anything else. It's really that taking it to the next level almost, taking it to a place where they just can't get unstuck and are really needing that additional support and additional outlet to really work through those, those concerns and to really address them in healthy ways. And we here at JFS also offer the mental health first aid, and we are going to be doing so virtually. So I think that's a really great tool for anyone in the community, whether it be a member of an organization or whether it be someone who just really wants to give back to, to the community as far as being that support.
That's great. Once again, to remind our viewers, we've got about maybe 12 or 13 more minutes left. We still have a little bit of time, so if you have a question that you'd like to put through, feel free to type into the comment box, and we'll try to get our panelists to answer. So really, we're going to have a great conversation now about how to overcome some of these barriers that people might be experiencing when it comes to seeking help. I guess the general question to ask is, we know that it's important for a person to take care of their mental health. I think that's pretty much been established. Why is it so critical for people to do that? Maybe now more than ever, right? Because like it's been said, there's so much stress going on for folks. So why do you think, maybe Jackie, that we need to be taking care of our mental health now, especially even more than maybe we did even before the pandemic?
I think that this really highlights how important feeling connected is. And really right now it seems like this is a marathon, not a sprint that we're in. The phased opening that we're going through right now, it's a slow process, and the virus hasn't gone anywhere. So the stressors that we've all been feeling, they might not be going away for some time, or maybe it's becoming to a point of, it's really built up. And you don't have to wait for things to get really bad before you reach out for help. You can reach out for help at any time. It's actually a great place to reach out for help when you're doing fairly well, so that you can build up coping skills that you begin to put into practice every day, so that when you do go into maybe a place of high stress and anxiety, that you have those coping skills in your back pocket to turn to kind of de-stress and de-escalate. So I think that really mental health is, it impacts everybody, and it's important for everybody. And right now, everybody's schedule and lives have been really drastically changed. So reaching out and finding new ways to connect and get support and learn some coping skills and this new virtual world that we're using to connect is really important.
Excellent. So Lindsay, following up with that, I think Jack is kind of tying into the idea of self-care, which of course I'm a big proponent of, but so why don't you share some self-care tips with folks, some things that you'd recommend to people so they can stay mentally, emotionally healthy during this time? What would you recommend?
Sure. So, and I think right now, especially, it's really easy to just not be aware that you're stressed or you have anxiety because there's so much going on and so many changes every day with the fluidity of the situation. So just take a minute, I think, is the biggest piece for everything. Just take a minute for yourself, whether that means sitting on your bed, just staring at a wall, or going for a walk outside, carefully, and just take a second to breathe. Doing some deep breathing, it helps in multiple different ways, both physically and mentally. So I'm always a huge proponent of that. Whenever I work with clients, I'd say, okay, the first skill we're going to learn is how to do an appropriate deep breathing exercise, just to make sure that you're doing it right and you're getting all the benefits from it. And just, it's okay to feel whatever you're feeling. And one of the areas that I have noticed is being able to acknowledge what those feelings are. Sometimes you're so caught up in life and there's so much anxiety and stress going on that you don't even know all the emotions you're feeling, and you're just mad. and I can attest to this personally too. I've definitely been irritable lately. So being able to just acknowledge, like, okay, I'm angry, but why? What's underneath that? Just kind of putting a name to your emotions for a minute and allowing yourself to have them is really important. And just acknowledging that they exist and it's okay to have it, and then breathe through it and accept what it is a little bit more. There's some other self-care techniques. Do something you like doing. Being outside right now is great, despite it being 90 degrees. I think that's really important for everybody to finally get some sunshine. Western New Yorkers especially, we like our vitamin D, we never get it. So that's always a big important self-care fact. And talking to your supports that you can, even though they may have to maintain distance, it doesn't mean they have to really be distant to have their conversations and reach out to. The Zoom calls are important. Play video games over the computer, things like that, to keep in contact with those you care about. Some people like to do some exercise or go running, writing, any kind of artistic thing is great. I know I myself paint when I get the chance and things like that. It's kind of therapeutic when you find what works for you. And it's about exploring yourself a little more to gain that awareness.
Excellent. Jennifer, do you have anything else to add? Your tips?
I think one thing that I found important too is not making it a chore. So, I see all of these advertisements about do a big project, run a marathon. I'm not going to do that. If I never ran before, I'm not running 13.1 miles now. So I think people think that if I don't do it big, I'm not going to do it at all. So I think really recognizing those small steps, like you said, it's 90 degrees. If I can walk around my block, really being able to do those small things and I think allowing yourself the ability to take the time for you. I think there's a lot of guilt associated with, I have a million things to do. I'm home. I need to do this. Really putting value on taking those few minutes and recognizing that my husband will benefit if I take 5 minutes to relax and, make sure I'm doing good, because if I don't, he's the one that's going to be paying for it come dinner time. So I think that really recognizing that, your loved ones benefit when you care for you as much as they benefit when you care for them.
And so speaking of that kind of care, so what are you and your organizations doing to promote the self-care for your staff? Because obviously, if your staff isn't healthy, then how are you going to help your clients? So what are your agencies doing to encourage, each of your
Sure.
staffs?
So we've actually extended our lunch. We've doubled the time that clinicians are able to kind of de-stress, not be holding those sessions as far as taking time for them in the middle of the day. Really working with ways in which they can make the telehealth process work for them. They all kind of rose to the occasion, they definitely rose to the occasion of offering those services. So really recognizing ways in which they can make that work for them in their day-to-day. We're definitely encouraging all of our staff to, take PTO as planned. I think some people have wanted to cancel that because they can't go anywhere. Again, really recognizing the value of taking the time for self-care. We're holding virtual happy hours, at the end of, regularly or town hall meetings. So everyone can get that face-to-face interaction. And then, really offering, those services to other agencies as well, as far as, brief their, specialized services, and really encouraging everyone to kind of, take care of their own mental health.
How about Jackie? So how about crisis services?
So, I definitely want to piggyback off of that. Just encouraging staff throughout the day, especially in MTS, I can really speak to. My staff now are very much so tied to their computer far much more than they were previously. Instead of driving to and from our clients' homes, they're jumping on visits, sometimes back to back. So encouraging them when you guys aren't on a visit to take a break from your computer, just as you would if you were in the office. Like, go enjoy a cup of coffee and touch base with your family. Have that 5-minute downtime in between calls. It's okay to take those breaks. I think people get very nervous working from home, that they really have to prove that they're doing work. And they're afraid to take those breaks sometimes, but just really encouraging that that's okay. And, I want you to be doing well. And if that's what you need, then absolutely do that. And on the plus side, staff have reported that now they feel like they're a little bit more forced to take a break, their full lunch break, which is a full hour, because, in the office, they might be eating, but at their desk, where now they're at home. So they really need to walk away, go make themselves something to eat. And maybe they're sitting at their kitchen table or taking a walk outside now instead of in the office. So it is a little bit more of a break for them. And then for our in-house staff who are still there, our board has generously donated some meals and to our staff, and there's been some amazing staff people who have contributed as well. I was in the office, I think it was last week, and somebody's brother made these amazing gourmet cupcakes. So just little treats like that. I mean, it was a beautiful cupcake. It seriously made my day. So just things like that, encouraging the self-care and the downtime, trying to stick to a routine, and utilizing supervision too, I think, is a really big component of self-care. For us mental health professionals, just to kind of debrief and consult with each other and feel support from one another.
Excellent. How about Lindsay? How about you at BryLin?
So definitely the counselor self-care has always been a big focal point for us, even before this, but even more so now. Some of the things that we do, we make sure we only schedule clients on the hour. So if after a 45-minute appointment, counselors get that 15 minutes, just kind of breathe, breathe or note if they want to, take a second, get that extra 15 minutes between clients to get resettled again. They all get their lunch breaks. Even working from home, we have our group case conference or staff meeting each week where it's a call. We all get to kind of come together for a little while for 2 hours and just check in with each other, talk about cases if we want to, see each other. And I think that's been huge in helping with the morale in general during this isolation period. I think that's been making a huge difference. We're also inpatient. I know that our staff is lots of free meals to try and help them out, being as flexible as possible to make sure everybody's taking care of them in inpatient, since they have to be on site all the time too. So, and we're all just past hospital week where we supplied lots of different food for everybody, ice cream, socials, distancing socials, and things like that. just to try to keep the morale up. But I think biggest aspect we try to influence is making sure supervisors are checking in frequently with self-care. And if somebody is overworking themselves, telling them to take it back a notch and making sure their caseloads aren't overwhelming and making sure their high-risk cases aren't too many of them, so we can parse it out a little bit and make sure they're taking care of themselves during this.
That's excellent. So we're almost out of time here. So I do want to thank our audience for joining us and our panelists. We had Jackie Crane, Program Supervisor for the Mobile Transitional Support Team at Crisis Services, Lindsay Herndon, Director of Outpatient Services for Mental Health and Substance Use at BryLin Behavioral Health System, and Jennifer Levesque, Director of Clinical Services, Jewish Family Service. Thank you, our audience, for joining us and our panelists. Like I said, remember, they represent a few of our over 50 plus coalition members. Please go to our website, letstalkstigma.org, to learn more about our members, the services that they provide, and other resources available in West New York. Join the conversation and be sure to take the pledge and end the stigma surrounding mental illness. Thank you and have a great day.